What's going on, y'all? Welcome back to the YouTube channel. My name is Kermit, and I am a surgical technologist at a hospital trauma level 1 here in the Midwest. And I want to give you guys a honest review of whether you or should not be a surgical technologist. And I have to start by saying you got to ask yourself at what point are you in your life? If you are in the position where you feel as if like, hey, I need a career change, I'm redoing my life, I'm reassessing everything. I want a career. I want to, make myself more dedicated, make myself be on time more, be committed to a goal, like to be around very intelligent people, feel as if you're trying to reach your potential, then I would say surgical technology is definitely something that you can definitely pursue, and I would encourage you to pursue. But I think as an individual, you have to really ask yourself, what do you want in this life? Do you want a work-life balance? If you do, then surgical technology might not be for you because it is a lot of hard work. It's a lot of dedication, and you have to sacrifice, especially on the front end of your career. You have to, take a lot of time and work to, get yourself out there and put yourself in an uncomfortable situation over and over and over again. To then at one point, okay, I've given myself enough opportunities to make myself look dumb, and now I understand the game. I understand the rhythm of surgical technology. Okay, now I can chill out a little bit. But at first, it's the work life balance, at least for me, in my opinion, should go out the window, and you need to be able to get a lot of cases under your belt, and then from then on, uh, assess if it's really for you or not. Struggles that you're gonna come up against are obviously number one, the surgeons. Those are the guys and the girls that are gonna be asking you to for instruments, for equipment, for preferences of how they like to receive things, what they like in their cases. You, as a surgical technologist, have to be okay with, I call it being a glorified bartender, because bartenders a lot of times they're hustling and bustling, prioritizing this drinks, this table, this. You are a glorified bartender because you're the one grabbing all these instruments and equipment for the surgeons. However, the element that is not the same is the fact that you're dealing with patients, and patients are valuable. They're they're you and I. When we go to the hospital, we expect for the people that are taking care of us to take care of us at the highest level, and so that makes a huge difference of being a bartender or a surgical technologist. That level of stress and that level of care that you're supposed to have for a patient is, completely different. But the prioritizing and the feeling of being asked to do a million things at once, that is something that kind of translates from one job to the next. And if you've always felt that the job that you're currently in, you're the best at it, you're really good at it, then that should transition you well into a career in surgical technology. Personally, my development outside of my private life has been a crescendo of, hey, I want to do something with my life. I don't want to just work from from job to job to job with not really having a purpose, to actually, okay, I want a career. I want to get paid really well, and surgical technology was something that was presented to me as an option. Everybody wants to get paid well and they want to get the money and the accolades, but they don't want to work hard nowadays. Dana White, one time said, all you have to do is just be a little bit savage and you can beat everybody in this world today, because everybody's so timid and so soft and they just want the easy life, the passive life. All you have to do is just be a little bit tough, just like 10%, 15% more tough than the next person, and you will have a great life, not just in surgical technology, but in other aspects of life. But in this aspect, we're talking about surgical technology, that if you were to be, 15%, a little bit more mentally tough than the next person, you will find a great career in surgical technology. Now, every game has different levels. Okay, you can be a surgical technologist, and after you put in that initial investment of not having a lot of time for other things and just putting yourself into the game of a surgical technologist, you can then find a lifestyle that's a little bit more balanced. You could work at a smaller surgery center. You could work at a private practice, or you could work at a big hospital if you want that. All the money, all the accolades, all that. You'll work at a bigger hospital, and then within that, you can work in general surgery, or you can get into an advanced specialty like a vascular, a cardiac surgery, or like a neuro. And those typically sometimes come with a little bit better pay, because you have to be on call more, so you have to be available more. Weekends, patients get really sick in those divisions, so you have to be a little bit more available. And since you give up more time, you get paid more. That's just how every job and every good career is. The more that they demand out of you, usually the more pay that you get. But again, most people nowadays just want to do the least amount of work and get paid the most. In surgery, that's not how it works. And in life, most of the time, that's not how it works. The people that get paid the most usually tend to work hard, and they technically or usually stay longer hours, work on the weekends. If that's not for you, then surgical technology is not for you, because again, you're working with a team of extremely dedicated individuals from the top, the surgeons, the nurses that have put in all the hours that they've had to do for their training, anesthesiologists, and so forth. You, as a surgical technologist, are also at that level of expertise. You're at that level of commitment, and everybody in surgery will see and will pick you out if you are who you say you are or you're not. In surgery, you cannot hide. You can't hide and be like, oh, I'm that guy. I'm super good, and they will find you and they will say, no, you're not good, and we don't want you here. So again, like, depending on what type of level of game that you want to be at, there could be a spot for you. If you don't want, if you're don't have all that much time, there's a place for you in surgical technology. But with every game, there's different levels of expertise and commitment that comes with it. And finally, if you're wondering whether surgical technology is for you, I would look at your personal life and see how organized are you in your life. And if you're in a trajectory, okay, if you're working, trying to get your life in a more orderly fashion, whether that's your finances, how you make your bed, how you brush your teeth, how you put your socks on, making lunches, if you're trying to progress and you're trying to make yourself a better person in your personal life, and you're trying to be more organized, not delaying things that you have to get done in your personal life, then a career in surgical technology is definitely right for you. Because You have to be extremely organized in surgical technology and in surgery so that you are on top of your game and you can help and be efficient in the surgery room with the surgeons. Um, we want to treat patients quickly, safely, and in order to do that, you have to be organized. All the instruments and the equipment that you gather, you have to have a certain level of organization, and there's a certain sequence that surgery starts off with and ends with, and you have to be able to keep all your stuff organized. And in your personal life, if you're on that level and you're trying really hard to wake up early, go to the gym, um, you know, get tasks done at home, build your house up, doing a bunch of different things that are trying to make you a better person, surgical technology is right for you. If at your house you're lazy, you don't do what you're supposed to do, you tell yourself, oh, I need to go on a run. Nah, I'll do it later. I really need to wash the dishes. I'll do it later. I really need to mop the floors. Nah, I'll do it later. If you're that type of person, surgical technology is not for you. Um, you need to be dedicated. You need to be at a level where you're trying to be great and you're trying to be better every day, because surgeons, they're trying to be really, really good. They put in a lot of time in their training, so they expect good things out of you. And then the supporting staff, the nurses, the anesthesiologist, everybody expects you to try hard and do a good job. So if you're thinking about going to surgical technology school, those are the things that you should think about. It's about, I would say, 4 years in total, 2 years to get your general courses done, and then 2 years after that to do a program. At least that's how it is mostly at the big hospitals. They expect you to, go to school and get credentialed. And there's different pathways to do that we may go over. But I believe everybody should be credentialed in a surgery environment to protect the patient, to protect the hospital, to protect, every member. We need to have a certain level of expertise to step into an operating room. You wouldn't want just somebody just coming in there and saying they can help when they really can't help when things go wrong. So those are my 2 cents about surgical technology. If you are interested, go ahead and shoot me an email, message me, put something in the comments, and I'll try to get back to you guys as soon as possible. Peace.